My name is Chase Beliles. I am a primary care physician at Graves Gilbert Clinic. I would describe family medicine or primary care as kind of the jack of all trades medicine. So it's very helpful for somebody that is having an issue, they're not sure what's going on, to meet with a primary care provider. There's lots of things that are more commonplace that we can manage: diabetes, high blood pressure, high cholesterol, other chronic illnesses such as heart problems or COPD. So I see patients ages 6 and up, and basically I see all sorts of ranges of patients with different health complications, all the way from healthy to more severe and complicated diseases anywhere in that age range. Anxiety and depression is two common symptoms or diseases that we see in primary care quite a bit. It is a combination, both anxiety and depression are a combination of a wealth of anxiety disorders and depression disorders that can be often very comfortably managed by primary care doctors. Signs that I see, or patients that usually talk to me about their anxiety, is they feel like something's a little bit more different for them than some of their other peers. They feel like they have constant thoughts on their mind, or they have certain specific thoughts on their mind all the time. Often these thoughts are not comfortable. They make them feel very uncomfortable. You feel very stressed out, you feel like your heart's beating fast, you feel extremely uncomfortable, and you feel like it's just something a little bit different in yourself than others. Often this is just due to a chemical imbalance. I think it's important with anxiety to understand that much like depression, it is just a kind of a chemical imbalance in your brain. Depression symptoms that I often see is really kind of, instead of this feeling very stressed out, just feeling very down. Again, it's kind of the attack on you. You have a problem, it's your fault, no one else is dealing with this. It makes you very unmotivated. Again, it's just this chemical imbalance in your brain that kind of causes these things to happen. Depression and anxiety benefit in treatment in two major ways. I believe they work best when done together. I think counseling is very important for both of these. It's very helpful to talk to someone, talk to a professional about these issues that you're having. It really helps you understand that you're not alone and you're not the only one that's suffering from these conditions, and that many people in the world deal with these symptoms and conditions, and you don't have to suffer in silence. Seeing a counselor can really help you with concentration and mental techniques to kind of change the way your brain thinks. As your healthcare provider, I can do that to an extent, but professional counselors can often help me quite a bit. And then medications can also provide patients with the ability to become more comfortable to even see a counselor and kind of help keep the symptoms at a more tolerable level to undergo counseling. I think encouragement and understanding are the most important things. Really encouraging them to see a healthcare provider, to let them understand that they do not have to live the life the way that they're living, where they're suffering every day. Life doesn't have to be that way. I put my heart into what I do by waking up every day and being grateful that I got to go to school and have a wonderful education to take care of people and make them feel better every day. And being able to do that in my hometown is just icing on top of the cake. What I enjoy most about serving the Bowling Green area is being back in town. I love to be back in town. I can relate to everybody here. We have the same culture and the same viewpoints on things. So I think it's very helpful to have a healthcare provider that sees things very similar to the way that you see things.